Welcome back to another episode of Hala City Podcast. Today we're talking about a subject that is a worry for a lot of people, breast cancer. And I know people have so many questions. So this podcast today with Dr. Patrizia will give us some answers that we need. Doctor, can you tell us about yourself?
Thank you, Aaron, for having me here today. I'm Dr. Patrizia Porcu. I'm a consultant oncologist. I'm focused in radiation treatment. And I trained in Italy, and I worked many years there as a consultant in Milan, and then I worked in the UK as a consultant. I'm focused on the advanced technique in radiotherapy, and I moved in the UAE in 2019, and since then I'm working here in Medicinic City Hospital.
Well, it's an interesting CV you have, and you've worked in some amazing cities. Breast cancer, let's focus on that part first. Can you tell us about what is the main risk factors?
So there are many risk factors around breast cancer in general. So genetic factors, first of all, and then lifestyle and environmental factors are all around the cancer and the cancer diagnosis. When we talk about genetic, we know that the family history impacts a lot. We know that patients, they have a relative with breast cancer, they have highly risk to have breast cancer. And patients, they have maybe had children in late age or late menopause or early period, they are more exposed to breast cancer. And patients, they know already they have genetic test positive for BRCA1, BRCA2. We know already that have high risk to have a cancer, breast cancer. Then we know there are lifestyles factors. These are very, very important, especially nowadays with our lifestyles. So we know that smoke is associated with an increased risk of cancer, and in particular breast cancer, and alcohol or the diet. So obesity or the type of food that we eat every day is associated with a high risk of cancer. And we know also that other factors like not being active, like sports, walking, anything is around the well-being. It can be a risk factor.
We talked about you're talking about early detection and obviously risk factors, what we're looking at there. But how does early detection play a role in the treatment of breast cancer?
Oh, it's very important, the early detection, because it can change completely the approach in the treatment. Because obviously, when we have a patient that has a diagnosis of breast cancer, stage precancer or stage 1, we know that the overall survival at 5 years is around 98, 99%, compared to having a diagnosis of breast cancer in more advanced stage, where probably overall survival is much lower. So the important, we have many factors around the importance of detect early, because even the treatment is different. So if we detect cancer in an early stage, most likely they will have surgery, and generally is lumpectomy or wide local excision. They just remove the cancer, and they will probably have radiotherapy afterwards. While if it's more advanced, the risk of having further treatment like chemotherapy or systemic treatment is much higher. So this is why it's very important to have early detection.
So we're focused now on the breast cancer component, but we're talking about more about your specialty, radiotherapy. So how has radiotherapy advanced for breast cancer?
Let's say, first of all, that I would like to say, what is radiotherapy? Because a lot of people, they don't know anything about radiotherapy. It's more something that scares patients. So radiotherapy is like a laser that it's high energy that is directed to the specific part that we want to treat with the cancer. And in this case, to the breast, that can be right or left breast, and to the lymph nodes if it's involved. Every patient that normally has a lumpectomy, they will have radiotherapy afterwards. It's the gold standard. While after mastectomy, after removing the whole breast, radiotherapy is not always done unless it's a little bit more advanced. Now, the beauty of radiotherapy nowadays is that we have more advanced technique that allow us to treat the cancer and to kill the cell, trying to protect and spare the healthy organs around the breast. For example, one of the more advanced technique that we have nowadays and that we use here in City is the deep inspiration breath hold. What does it mean? We ask patient to take a deep breath, to hold the breath while we are treating. So in this way, we can completely spare the heart and we completely decrease the toxicity and the dose delivered to the heart, especially on the left breast. And you can understand this change completely. Toxicity, the treatment, and also a lot of patients, they are very worried about receiving radiotherapy because of that.
I think automatically when patients hear the cancer word, and I think especially with breast, people associate that they're a mastectomy, just cut it out, that because the people are frightened. It's reassuring to hear that radiation treatment has changed in advancements as well, that you can treat things differently. So techniques you've mentioned just now, but what other techniques do you have that's changing in radiation therapy with breast cancer?
What is changing is not just the radiotherapy, it's the way we deliver the radiotherapy. So, and it's a very, very good question. Thank you, Aaron, because the majority of the patients that sit in front of me, they are scared of radiotherapy because there is not enough knowledge around radiotherapy. Everyone knows chemotherapy, this word, and they are scared as well, but they know what it is. So radiotherapy, first of all, is a local regional treatment. So it's only targeted to the cancer in itself, not on the rest of the body. And the difference nowadays is that we can conform better in shape the beam, the radiation, better on the cancer, trying also to protect what are the organ around, so we spare the healthy tissue around. So what was frightening a few years ago, it should be less now, because we can really protect everything around, increasing the dose and killing the cancer cell. Now, what is changing is that now, for example, we can protect and spare the heart because we do a special technique that is called deep inspiration. So we ask patient to hold the breath, and in this, while we are treating, while we are delivering the beam, and in this way, the diaphragm, so the chest expands, and the heart goes completely away from the radiotherapy field. And we can really protect and decrease the dose. And this is very good when we are treating the left breast, because we can completely avoid the heart. And this is what is the improvement. Radiotherapy is still the same in itself, but it's the technique, the way we deliver, that is improving.
Many, obviously, the damage to organs previously, now you can clearly, specifically look at what you're attacking, and that's the cancer. I think that's what you're coming across from that.
Correct. So what is the new changes? What is also the way the world is going, is more the way we check the new artificial intelligence. We use a lot of imaging around radiotherapy. So we are able also to see exactly where we are delivering the field, the beam, at the same time we are delivering. And also when we do the breath hold treatment, we can check the gating, the motion. So it's a very advanced technique. It's a treatment in 4D. So we are able to treat the patient while we are controlling and checking everything, what's going on at the same time during the delivery.
So if a patient was to undergo such treatment, is there any complications with this specific treatment, or that you would, any sort of side effects? Because obviously you see from social media side effects with cancer treatments, and what sorts of side effects would you see from this? Is it minimal, or?
There can be some side effects, but as I said, because radiotherapy is a local regional treatment, what we are going to affect is only the specific part that I'm treating. In this case will be the right breast, the left breast, and the lymph nodes in case they are involved. So mostly what I'm expecting are skin reaction, and sometimes there can be some swelling of the area. If the patient had lymphedema after the surgery, they can have, some of them can be increasing, the lymphedema increase, or some cording, but they are mostly related also to the surgery. But I can tell you that this type of toxicity, or this type of reaction, are minimal, and we can really control and check. And this is also the beauty to have a treatment in a proper cancer center with a specific team with highly skilled that have the ability and the knowledge to treat. But this type of technique, like I said, they also allow us to decrease the toxicity.
I know some of the viewers, obviously we talked about early detection, which is great, and the treatments are varied, and it's great to hear. But what about those patients that come to us who are in the stage of metastatic cancer? How does radiation play a role for them?
The changing part in the oncology treatment, because in the past, the patient with a cancer, maybe when it's advanced stage, we always think, oh, okay, it's too advanced, we cannot do anything. But nowadays, with the new technique, we can do much more. It means that we have many times patient coming with breast cancer, and they already come with maybe a metastasis somewhere, like in the bone, on the liver. And it doesn't mean that we cannot still try to cure the patient, because with the new advanced technique, we can use like radiosurgery. So we can treat at the same time the breast and irradiate with high dose the metastasis. And this is because we have the new technique that allow us, like I said before, to deliver high dose, sparing everything that is around.
So at Mediclinic, you offer, what sort of services do you offer in radiation therapy? What can you find here at the hospital?
I'm proud to say that we are a cancer center. And this is what makes the difference when we are treating a cancer. Because it's not just the radiotherapy, it's not just the chemotherapy. It's a lot of things around the patient. First of all, patient is in the center of everything. So the beauty of coming to a cancer center is that there are many specialists that they work all together trying to deliver the best care to the patient. So there will be a radiologist, pathologist, surgeon, oncologist, radiation oncologist. There will be a psychologist, dietitian. There is an amazing team that is going to take care of the patient in a 360 way. And the beauty also of a cancer center is that we have the tumor board. It's where we decide the best treatment care for the patient. We have the multidisciplinary approach in general. We can use trial. We use the up-to-date research or the new treatments, and we apply them to the patient. We give the best care possible to the patient.
So a lot of people out there are going to be thinking their mum, their nan have had breast cancer. You talked about risk factors. You also talked about the BRCA, genetics. What's your take-home message to people? What do you want to tell people that may be watching this podcast who are worried?
A few things. First of all is early screening and early detection is what makes the difference, because this can allow, even if there is a cancer, when it's detected at the beginning, the type of treatment and the type of diagnosis or the care is completely different. So early detection, and to check for familiarity. So if they know they have someone in the family, they need to start earlier with the diagnosis. And also I want to give a positive message is nowadays the treatments are different. We can cure breast cancer. We can cure in a safe way, safer than before. And the beauty is that we are going over towards an improvement of the treatment in general. I think the beauty is that it's not just the radiation, it's not just the chemo. It's all together that is working around the patient to deliver the best care.
Thank you so much, Dr. Patrizia. Even for me today, I've learned a lot about the stuff you're doing, and it's an amazing. I think if our viewers are ever worried, it doesn't matter what stage you are in your cancer treatment, or you just want some advice, the doctors here at Medicinic City Hospital are here to talk to you, and they will look at you holistically, and I think that is really important. Thank you so much, and we look forward to seeing you next time on Hala City Podcast.